senior-friendly care. So my name is Melissa Toinema. I'm a nurse by background. I work with the Northeast Specialized Geriatric Center. We're a regional geriatric program, and currently my role is I'm a senior-friendly care lead for Nipissing and Temiskaming. I'm predominantly, I work out of New Liskeard, however. And prior to this particular role, I was the geriatric nurse clinician that ran the geriatric clinic for Temiskaming District in New Liskeard. So welcome, everyone. Let's see. Sorry, I'm just having some problems. Oh, there we go. So today what we'll talk about is we'll discuss senior-friendly care, and I'll connect it to why that's important to a lot of the work that you may be doing as either a volunteer, a learner, for example, or possibly moving into the healthcare field. I'll discuss what senior-friendly care is, and in particular, the framework. I'll also share with you what older adults have told us about how they want to be treated when we're providing care or support to them. I'll make you aware of some age-related changes today that you have to be mindful of when providing care to older adults. We'll also discuss kind of the top 10 things or tips that you can do right now to make a difference in the way that you may provide care to an older adult. We'll also discuss the importance and the opportunity that exists for social engagement. And lastly, I'll provide a few strategies that you can use to promote overall well-being for older adults if you're providing kind of direct care or support in the home or any kind of interactions that you may have. So why is senior-friendly care important? Understanding the needs of older adults is helpful because it will change the way that you go about delivering care, and it'll make sure that you align the care that you are providing with what older adults are expecting you, and not just what you think that an older adult may want from your support or your care. Also, by providing senior-friendly care, you're very much contributing to the better health outcomes for older adults. So that might be their general sense of well-being, that could be contributing to their quality of life, that might be supporting their social role and engagement. So providing senior-friendly care really aligns with all of those goals and outcomes. And it has been shown that it can increase your satisfaction as a volunteer, as a clinician, as a learner, to make sure that you're providing the type of care that is meaningful to older adults, their caregivers, and their families. So what is senior-friendly care? And senior-friendly care framework is really a blueprint of what care should look like for older adults. And I have to say, even before coming on board and doing some collaboration with the Near North Palliative Care Network, this organization was already putting in tremendous work and tremendous effort to make sure that all of their organizational values, their direction, their guiding principles all align with senior-friendly care, and in particular, this framework. They're very much, this organization is advocates for care of older adults across the region, and their programming and their services that are being offered are constantly evolving to meet the needs of older adults and their caregivers. And we saw an example of this throughout COVID. Certainly this organization identified that there was a changing kind of environment of how older adults had to go about accessing care, and that was really the reliance on virtual care because of COVID, and they established their tablet program. So that's an example of how this organization is really working towards being senior friendly. And certainly a commitment that the Near North Palliative Care Network has made is to make sure now that all of the staff, the volunteers, and the learners reflect the senior-friendly care values that this organization portrays. So the best way to find out what someone really wants is, of course, to ask them. So the Regional Geriatric Programs of Ontario, they conducted a series of interviews or conversations, surveys, and focus groups to determine what older adults want and need from the care that they receive. And what they found is that older adults say that they very much value interaction with their care providers rather than just receiving a pamphlet or a piece of paper with information on it. So it's really important that if you're going into someone's home or you're having an interaction, say over Zoom, that rather than just leaving behind a resource as you're heading out the door, that you're making sure that you're really taking the time to have a conversation about the information that's on that pamphlet. Maybe take the time to highlight the key points, make a star or a circle about what's really important information that they may want to have in an urgent situation, for example. So make it meaningful to them. They also want any type of care provider to understand that they are a unique individual and not just provide blanket kind of care that they think that every single older adult might want. So while there are age-related changes that we very much should be mindful of when we're providing care, it's important to remember that an older adult's experiences, their preferences, and capabilities make their needs very unique to them. So a good example is if you're a volunteer and you're going into the home and you've been asked to maybe support with some meal preparation, and that might be either due to weakness, it could be due to fatigue, dementia, or an illness. There's an older adult may want that support in very different ways. So for example, you may have an individual where while raising a family or in their younger days, they would have provided all of the meals to their family, and they receive a lot of, it's a source of pride for them to be able to participate in meal preparation. Well, that individual likely is going to want to participate in a way that matches their current capabilities rather than just having the meal prepared for them. But on the other hand, you could have another individual that may be perfectly happy with receiving that support and having the meal provided to them. So the best way to know is, of course, to ask about the level of participation and activity that an older adult wants to engage with you in. Older adults also want their symptoms explored and an explanation for their symptoms to be provided. They don't want us to just think that their health concerns are brushed off as being age-related only. And in fact, if we were to just brush off symptoms as being age-related, then we may miss the opportunity to help support an older adult to go and receive the type of care that they actually do need. So an example of this might be that if you're a volunteer or a learner going into the home of someone that has just experienced significant loss and you're providing bereavement support, that individual, for example, might mention during one of your conversations that they notice that their memory is getting quite worse. And most of us do know or do associate that memory problems tend to show up more for the older adult population, but that's not something that we just want to assume that memory loss is just a fact of aging and respond to that older adult's concerns that way, because it would be very important in that situation to actually encourage them to go and seek answers from their family physician or some other clinical staff that was involved in their care, to let them know that they're experiencing some memory problems, and because it might not be an age-related concern. And an example of that is, again, if you're going into that home to provide bereavement support, short-term memory loss can actually be a sign of depression and not true memory loss associated with something like dementia. So either way, you would want to make sure that that older adult is receiving the care that they deserve through a family physician or another clinical staff member. Older adults also want providers to be informed, be positive, encouraging, engaged, respectful, inquiring, culturally sensitive, and not condescending. So important to kind of understand who they are as a person and get to know them on an individual basis when appropriate and when possible, and not to use condescending terms like dear or sweetie, unless that's something that provides comfort to the older adult. And one of the best ways to kind of accomplish this approach is to keep in mind to be personal, get to know the older adult, and not to be rushed. So really facilitate a conversation during your interactions, because it's much easier in that type of context for the older adult to participate and share their thoughts and concerns. So when I was still a clinician and going into homes, rather than completing a checklist as a way of identifying their issues that they wanted help with, I would start by having a conversation, and I would say, I would like to know your story, and how far back do we have to go for me to understand what's contributing to your current concerns or issues, or what I can help you with, and establish what was important to them. So that's tended to be how I approached care for older adults. So with aging, certainly does come some age-related changes. But of course, as I've mentioned, you have to be mindful that older adults are not all alike. And again, their experiences, their preferences, and their capabilities do make their care needs unique to them. But we should be mindful of a few things. And one being that an older adult may need more time to recall or learn new things, and they may also have a decreased reaction time. So this is really important when having a conversation with an older adult. You really should be trying to pause after you ask a question and provide time to respond. Because it takes some time for the older adult to be able to process what they've heard, kind of interpret that information, and then also formulate a response. So not to jump in right away and offer the answer, pause. And if you see some frustration because maybe they're having some language difficulties and they can't get some of the words out, then it may be appropriate to provide a few prompts or cues, but make sure that you're allowing that time and that space in the conversation for them. Also, older adults may experience some visual changes, such as a decreased ability to focus or to resist glare. And they may also have some difficulty adapting to changes in various light levels. So in particular, when you're seated and having a conversation and kind of settling in with an older adult, make sure that they're positioned so that the sun isn't directly in their eyes. If you're doing a particular activity, you may want to prompt to make sure that they have their glasses available and on if there's someone that has experienced some vision changes. Hearing may also be altered for older adults, and it does make it difficult for them to be able to hear high-pitched sounds or have a conversation or hear a conversation when there's a lot of background noise. So again, if you're having a conversation and it's an important conversation to have, you may want to ask if it's okay if you turn off the radio or the TV that's in the background while you're talking, to eliminate some of that background distraction and the competing noise that makes it difficult to hear and understand what you're saying. And also, rather than always trying to adjust the volume of your voice for an older adult that's having difficulty hearing, Also try adjusting the tone of your voice. So it's much easier to hear kind of the lower registers, and also try and keep a slower cadence to your speech to allow for some of that delayed processing. Also, an older adult may have less physical strength than they used to, or they may have experienced a decrease in balance or coordination. But we also have to keep in mind what the older adult's initial starting point was for strength at a younger age, or it could be even a month ago. So for example, a more extreme example, I would say an older adult that was a competitive athlete, they may not be able to kind of compete at a competitive level anymore, but they still may be much stronger than many other folks their age, or actually I would argue probably even than myself. But the important point to that example is that the tolerance for activity should be determined by the older adult themselves and on that particular day, because all of our strength and balance and coordination changes day to day, depending on what our energy levels are like. Did we sleep well? Have we drank enough water? What's our motivation? So making sure that just because you went into the home a week ago and the individual was feeling quite weak, they could be having a good day and able to do more for themselves on that particular day. So here are some top 10 things that you can do right now to make your care more senior friendly. And the first is, again, when you're having a conversation, don't rush. Try to avoid any rapid fire questioning. So going through that checklist or kind of volumes of information, pick out the key pieces that are important for that individual, and avoid interrupting or offering those prompts or cues until you're certain that you've given the older adult the time they need to be able to respond. So overall, just keep in mind to try and use a conversational pace to how you approach discussion. Also, make sure that you're using simple and common language. So a lot of us in the healthcare services or community support services, we tend to use a lot of acronyms. Try and avoid things like that because they're not meaningful and they don't make a lot of sense to the older adult. If needed, don't be afraid to ask for clarification. And if it's because of a language issue that you're not quite understanding what was said, I tend to approach it saying, I'm sorry, I missed that. Can you please repeat? If you're not understanding the content of what the older adult is trying to tell you, just ask for clarification. Say, please help me to understand better. I just don't want to misinterpret what you've said is a good strategy to use when you're having conversation. As I've previously discussed, make sure that you're talking slowly and clearly in a normal tone. Avoid shouting or speaking in a raised voice because that can actually distort the language, and then it also comes across as quite abrasive. It seems like you could be yelling at the individual, and that can make them quite uncomfortable, as with any of us if we have someone raising their voice towards us. Eliminate the background noise. So for some folks, you may be going into the home to provide some volunteer support services, and it may be perfectly appropriate to have the TV or the radio on because you're sitting quietly with them and enjoying the moment. So always make sure that if you're going to change an aspect of an older adult's environment, like shutting off the TV or the radio, that you're doing that with purpose and only because first you've asked if it's okay. So is it okay if I shut off the radio while we're having this conversation, but I'll go and put it back on as soon as we're done here. This number 6 is to remove trip hazards from their home. And, I bring this up because, again, we have to be mindful that if you're providing care in the home, that's their comfort zone, that's their personal property. So certainly we don't want to be making big changes to their environment. However, if you saw something that, say, a box that had fallen over and it's in the way of the older adult trying to get to the bathroom, it's appropriate to ask and say, is it all right if I move this box and put it on the shelf so that you don't trip over it? That might be an approach that you may take to eliminate trip hazards and reduce risk of falls. Also offer assistance if the older adult needs some help with sitting or standing. But again, don't just jump in and provide that assistance. Make sure you ask them. Certainly an older adult, again, their strength or their coordination or balance will change day to day. And I personally find that by asking, I'm always told whether or not help is needed from myself. So oftentimes when help isn't needed, the individual will say, oh, no, it'll just take me a couple minutes longer and that's fine. I certainly am in no rush and I'm patient. Other times they'll be like, yeah, I could actually use a boost. And at that time, it's appropriate to step in and provide that actual assistance. A great tip is to make sure that water is available, or I would substitute water and say, their favorite drink that they're allowed to consume or is in line with their goals of care and their health. So for some that might be some coffee if appropriate or tea, but fluids in general are really important. But if you're going and saying providing palliative care to an older adult with some cognitive impairments such as dementia, oftentimes they actually need a few prompts throughout the day to actually remember to drink. And oftentimes, I shouldn't say oftentimes, older adults don't want to be treated like a child. So just saying, oh, remember to drink isn't necessarily the best approach to prompting kind of water intake. I always use the approach of, oh, I've noticed that your tea has gone cold. Can I get you a top up or can I refresh your drink for you? And that usually is a cue enough to remind someone to take a sip, or you can go and heat up their cup, and then just putting it back in their hands oftentimes again is a cue. Also make sure that there's adequate light to have that conversation. So you want to be careful about kind of direct glares of sunlight, but also make sure that you're in a well-lit area when having a discussion, so that it's possible to read lips and also read your facial expression, because that can help with interpretation if they're having some difficulties with hearing or with language. And lastly, if you're selecting any resources or printed material to bring into the home with you while you're providing care, make sure that it's providing complete information, that the wording is simple enough, and that ideally you want the font size to be about a 14 font size. But if you're not printing that off electronically, it's not always possible to tell, but a fairly kind of robust font size is necessary. So we'll move away from some of these more general tips and talk about social identity and kind of the purpose it has when you actually move towards providing more direct interactions with older adults, either in their home or through virtual care. And certainly an individual's social identity is very much determined by a combination of complex characteristics, and that's everything from gender, their race, social class, age, ability, their religion, sexual orientation, and also their place of residence. And this isn't an exhaustive list. And unfortunately, we may misunderstand an older adult's social identity because we are inappropriately attributing our own identity for theirs. Some folks may have some biased attitudes towards elements of an individual's social identity. And then we also may jump to conclusions based on an element of an individual's social identity. So for example, assuming something about someone because of the way they dress, the way they talk, or their behavior. So when I'm beginning an interaction with an older adult, I always take the approach of asking that individual how they want to be addressed. And for many folks, this is the opportunity for them to identify how they do want to be addressed. Some folks need some prompts, and usually I'll start with, would you prefer that I call you by your married name, for example, or your first name? Is that appropriate? And then I'll also introduce myself as well to them and give permission that they're free to call me by Melissa. I'm a nurse, things like that. You also want to be mindful that an individual's social identity can be a source of pride for them, but that's not always the case. Even if we think of how folks attach their social identity to residence, can differ amongst people. So some older adults attribute a lot of pride to be able to remain in their home, maintain a sense of independence. I know for I certainly appreciate that part of my own social identity. But other folks, for example, may prefer to be well supported by their loved one and their family, and being part of that life stage and having other members of their family care for them in a more home community environment may be part of their social identity. So very different perspectives, even regarding something like their place of residence. Also, understanding the meaning of an individual's social identity can really help us define causes for loneliness and avenues for support. So on the screen, you can see my example that I have there. So an older adult that's a newcomer to Canada and has English as a second language. To address their unique experience of loneliness, first we have to be able to identify those pieces, but next find them supports for newcomers and be able to, say, participate in social engagement and activities in a language that is comfortable, maybe quite important for their own social well-being. So as I said, so each visit is really an opportunity for social engagement and an opportunity then to reduce loneliness, increase an older adult's resilience by providing them with a social network or social connection. So it's important to make everyone, including older adults, to feel like they matter and that they're connected to other folks. Now, not everybody likes to have a large social network. It very much depends on your personality and your comfort level, but certainly offering that opportunity to engage when you're having an interaction and making it personal and meaningful to them, it is an important aspect of care. Also, allow the individual as much control as possible, particularly when you're entering into their home, but even in the virtual world in terms of what are the topic and nature of the conversations that they want to have or they're willing to have. So really let them guide that aspect of the discussion. But if you're going into someone's home, make sure that you're not assuming that it's okay to sit in a particular spot in their home. So I would always ask, where's your favorite seat? You know, where would you like to sit down? Where would you like me to sit down? Or where can we get comfortable? I always keep in the back of my mind that I'm a guest when I go into someone's home. And lastly, social engagement doesn't always have to mean that it's an established conversation. Social engagement can mean that you're just present with the older adult and you're able to sit and enjoy the moment with them. And As part of social engagement, certainly there's evidence to suggest that reminiscence can be really helpful for alleviating a sense of loneliness. And in particular, narrative reminiscence has been shown to be consistently positive in terms of the kind of conversation that older adults want to have. And narrative reminiscence, what it means is that the older adult has the opportunity to share parts of their story or parts of their lives with you. So rather than just relying on talking about the weather, talking about the news, for example, some older adults want the opportunity to have a more meaningful and a more personal conversation. And then it often gives a starting point when you say go back for a second visit or subsequent visits. It's important to have the opportunity to pull from those previous conversations, like, for example, connect it to maybe a local event. I heard last time I was here, you told me that you were a firefighter in your younger days, and I see we have some, say, forest fires in the area. Tell me more about that. What was your experience as a firefighter in your younger days? Opportunities like that hold meaningful opportunities for conversation and for connection. So now we'll move into some kind of care strategies that promote well-being for older adults. And in particular, you may be wondering why I have a delirium wheel up on the screen. And when I say delirium, what I mean is an older adult that has experienced some confusion that's different from how they normally kind of act day to day. But the reason why I have these delirium strategies here is because any of the strategies that we implement to prevent delirium are good for overall health and well-being for an older adult. So it's a good kind of summary to be able to prompt some ideas about tasks that you can do that will promote an older adult's well-being. Of course, we have to remember that any of these particular strategies have to be aligned with the older adult's goals of care and aligned with their preferences and individualized to them and their setting. So a good example is making sure that you're stimulating their mind when you go for a visit. And a lot of that is actually promoting that social engagement piece that I just discussed. But there's also other options, such as participating in cognitive activities with the older adults. So that could be anything from completing card games, doing word searches, knitting. But it's important to note that you should only be offering activities that are already an interest to the older adult or connect or align to their particular pastime or hobby. It's not appropriate to just introduce an activity for the sake of completing an activity. Research shows that that's not effective because it can create frustration, it can cause disinterest, in particular if the activity is too hard for that individual's capabilities. So make sure you're aligning any activities to something that's really identified as something that the older adult finds fun and meaningful if you are going to complete an activity with him or her. We'll talk about movement in the next slide. And other key strategies include promoting good sleep. And many of you might think, well, when I go into an older adult's home, I'm usually not going in the evening or late hours of the day. But it's important to know that practices and routines that we establish during the day, those are actually what promote a more restful night for an older adult. So in particular, encouraging movement or mobilization during the day, that helps to increase sleep demand at night. So is an effective tool to be able to help someone sleep better. Also, that active engagement, such as the activities that you may be doing with them or socially engaging with them, all of those help to provide opportunities for alertness during the day. And then lastly, a great strategy is at all possible, in particular before noon, try and promote access to natural light and getting outside if it's at all an option, because that certainly helps our sleep cycle. So, if it's available, see if the older adult has interest in, say, going out on their front or their back deck and having that coffee or tea with you. Or if it's appropriate, moving around outside in the yard or up and down the street. Those are great strategies. We've talked about seeing and hearing, but again, just ensuring that an older adult has access to their various aids that they might need. For an older adult that doesn't have hearing aids, but does have some hearing impairments, some organizations have what are called pocket talkers, and it's a low-tech microphone system with headphones and a little speaker for yourself that tend to be very effective for folks that are having problems communicating because of a hearing impairment, but don't have their own aids. So that's something to consider if you do have access to that. And in the next few slides, I'll talk briefly about staying hydrated and eating. So again, depending on the older adults' goals of care, also their abilities and capabilities and stage of their life. Here are some kind of mobilization ideas for someone that has the ability to be more active, and that might include prompting them to stand up during a commercial break, or when they're finished a chapter of their book, or knitting a row of a blanket. Those are all great prompts or cues to promote mobilization. And that can just be standing up and doing one little lap around the living room. Any little bit of movement helps us. Also, trying to extend the time it takes to complete some chores, so multiple trips, for example, of cleaning up certainly helps to increase mobilizations. Whenever possible, standing up to do things like prepare a meal or even to have a short snack. I wouldn't suggest trying to stand up for an entire dinner because that tends to be a more relaxed and social opportunity, but for something like a snack or breakfast, it could be an option. And standing up to meet friends. So rather than just calling someone in if they knock on the door or ring the doorbell, actually getting up, walking over to the door to be able to greet them and allow them into your home are all great strategies for mobilization. And for those folks that are chair or bed bound, certainly, if possible, encouraging them to do their seated or their lying exercises that have been likely outlined by a healthcare professional, or helping them to adjust and get comfortable are really important movement strategies. And lastly, it's extremely important for an older adult to be able to stay hydrated and eat well. But again, it has to be aligned with their goals of care. So someone that's at end of life, they may not be as focused on nutrition and hydration, maybe more about comfort levels, such as maintaining kind of moist membranes and making sure that they don't feel as dry. But for those folks where it is aligned with their goals of care, it can be quite helpful to provide and offer their favorite beverage or encourage them to have a suitable snack or small meal while you're there. For folks that it's important for them to, say, adhere to a particular diet. So for example, if you have an older adult and you're providing some care because they have dementia, and they also have diabetes. It may be important for them to keep track of their sugar, so you could offer to help read food labels for them. Again, for those folks that maybe you're providing some support for that have dementia, sometimes they forget to clear out food from their fridge or from their cupboards. So you could offer to help organize and remove any of the spoiled foods for them. But again, make sure that you're always discussing that even before you open the cupboard or the fridge. Ask if it's okay, ask if they want that help, and if they don't, then please be respectful of their decision. If at all possible, coordinate visits to assist with meals as required. That can be very helpful because meal preparation tends to be a challenging task for those that are more weak or have some memory loss that makes it difficult for them to organize and prepare food. Eating for many individuals was a social opportunity or a social action. So offering the opportunity to sit down at the table while they enjoy their dinner can be particularly meaningful and help an older adult to consume or feel like even eating. And lastly, of course, when appropriate, you see someone struggling or not being able to get to their food, offer to help with setup or assistance with things like opening up packages and so on. So for those of you that are interested moving forward in learning more about practical guides and information and more of these strategies to use to support your care for older adults, the Regional Geriatrics Program of Ontario has free resources available to support further learning. And in particular, I put up this PSW pocket guides. And it's really good and a handy kind of resource for those that are in particular going into the home and providing maybe volunteer services. And because you don't need to be a healthcare professional to be able to use any of these strategies that are outlined in the document. And I'm just going to switch my screen for a minute. So bear with me because I'll take you through how to access some of these materials. Okay, sorry. Okay, so a lot of these materials are on the Regional Geriatric Programs of Ontario website. And all you have to do to get here is, I have put it on the slide, but it's as simple as putting senior friendly care into a Google search bar. And this will be the first kind of hit that comes up, and you can click on it and it'll bring you to this particular page. And then you can navigate to the Go To Learning series at the bottom. And if my computer will work, there we go. And this is where you can access all sorts of free resources, presentations, many of them of which are actually narrated, to learn about senior-friendly care strategies. And I would recommend that if you're a volunteer that does not have kind of a healthcare background, then I would recommend using resources that are geared towards caregiving, because they tend to be at more of a level where you don't need that clinical assessment and intervention type perspective. But if you're a learner that, or an individual that's providing support and you do have a healthcare, oopsies. Sorry, I clicked on that by accident and didn't mean to do that. I'm having problems seeing all my tabs, just bear with me. If you are a healthcare professional or a learner heading in that direction, then there are particular resources for clinical staff, and you'll see them here. They're outlined as the clinician learning series, so that's a great option, and all of those presentations are narrated as well, so a great option. So I'll navigate away from here for a moment. So on that note, does anyone have any questions for me about anything I've talked about today?